Uh, Hi everybody. Today we'll discuss about anatomy of the nose. Okay. So as you know, nose is one of the important structure of our body, and how it is important. It gives shape to our face. A very good looking face means nose should be in the proper position, proper size, shape. Then only we can tell. Any disparity in the nose also affect the face. So that is the reason nose is one of the important organ of the face, at least for cosmetic purpose. So today we'll know something about the anatomy of the nose. So before going to anatomy, it is always wise to know about the development of the nose. And as you know, the fourth week of intrauterine life, a small olfactory placard develops. And from there, it slowly deepens to form an olfactory pit. And fifth week of intrauterine life, it still depend to form nasal sac. I'll show you the picture in the next slide. And then develop medial and lateral nasal process, frontal nasal process, and maxillary process. Just I'll show you the picture, you can understand. So yeah, so this is the placard. First this develops, slowly it gets deepened to form the nasal pit. Now again it increases in size to form the nasal sac. Okay, so this is suppose anterior, this is posterior. Now it will be separated from the oral cavities. It will canalize to form the nasal sac. Then what happened? The different process. This is primitive, this is medial nasal process, this is the lateral nasal process, and this process is called the front nasal process. Medial nasal process, lateral nasal process, front nasal process, and this inferiorly comes the maxillary process. Okay, so these four processes come together to form the nasal cavity. From all sides it comes and form a closed cavity, that is called the nasal cavity. It's very clear. Now I can see this picture here. This is the nasal cavity, cornal section. This is the septum, both side to nasal cavity, and this is the palate. Now this is the oral cavity. Okay, so this is how slowly it develops by medial nasal, lateral nasal process, maxillary process, and front nasal process. And then regarding paranasal sinuses, paranasal sinuses are the air containing space surrounding the nasal cavity. That's why they are called paranasal sinus. The maxillary sinus develops as 7 to 10 intrauterine weeks, ethmoid sinus 4th intrauterine month, and frontal sinus usually develops after birth. So maxillary sinus is first to develop in human. Yes, now coming to the external nose. Nose is external nose. So nose is a pyramidal substructure. It looks like a pyramid. That's why always we talk nasal pyramid. Okay, so what is the constituent of nose? It mainly consists of bony part and cartilaginous part. And if you see, the bony part is 1/3 and the cartilaginous part is lower 2/3. Upper 1/3 is bony and lower 2/3 is cartilaginous. Okay, now I'll show you that picture, then you can understand. Now regarding the bony part, in upper 1/3, it consists of two nasal bone. Two nasal bone, they combine like this and form on both sides. The bone is nasal cavity. Regarding the cartilaginous nose, it made up of few cartilages like upper lateral cartilage, 2 in number both side, lower lateral cartilage, again 2 in number both side, lesser ulnar cartilage, 2 or more in number because they are very small cartilages, and septal cartilage is the middle. Now lower lateral cartilage is sometimes called ulnar cartilage. So it is the ulnar cartilage and lesser ulnar cartilage. Very small tiny cartilages are there. I'll show you. Then you can understand. Yeah. So now you can see here. This is the nasal nose. Now this upper 1/3 is made up of bone. This is the nasal bone. Okay. Now this is lower 2/3 made up of cartilage. Now this is nasal bone one side and opposite side another nasal bone will be there. Now here in the cartilage is concerned, this is the upper lateral cartilage, this is the lower lateral cartilage, and or alar cartilage. Here will be lesser alar cartilage. Okay, septal cartilage will be in the middle. I'll show another picture. So this lower lateral cartilage or alar cartilage is a U-shaped structure. This is a flat structure. This is a U-shaped structure. I'll show you. And here the lesser alar cartilage will be 2 or more in number. Some very small cartilages will be there in between. There also give some shape to the nasal cavity. Now you can see this is the uh, alar cartilage. Alar cartilage or lower lateral cartilage. Sometimes it is called greater alar cartilage. Okay. Now it's a U-shaped structure with medial cross, lateral cross, and dome. This side also medial cross, lateral cross, and dome. Okay. So this gives shape to the tip of the nose, lowermost part of the nose. Now coming to the septum, the quadrilateral cartilage in the septum. This is the quadrilateral cartilage. Actually, this gives rise to this is the cartilaginous septum behind which there is bony septum. We'll discuss this. So this is another cartilage which is there in nose. So there are 4 types of cartilage which is there in the nose. One is the upper lateral cartilage, lower lateral cartilage or alar cartilage or greater alar cartilage. Then lesser alar cartilage, 2 or more in number, very small tiny cartilage. And another is this quadrilateral. So the cartilage mainly constitute the nose. Now coming to the nasal musculature, here one is called procerus muscle. These are the muscles of the nose. Procerus muscle is extension of occipital frontalis muscle or frontalis muscle that extend downward towards the nose. That is called procerus. Now nasalis muscle has got 2 parts. One is the transverse and alar part of the nasalis muscle. Levator levi superior is a lac nasi. Okay, and dilator naris, anterior and posterior. So dilator naris muscle is sometimes important. How? When we take breath, it dilates the nasal on anterior naris. When we breathe in, it dilates, so that more air will go inside the nose and into the lung. That is the work of dilator naris. Depressor septi is the muscle which will drag the septum downward, depresses the septum. These are not that much important. Here the dilator naris is one important muscle in the nose. And next, skin of the nose. Now, the skin of the nose is different. Like over the bone, it is freely mobile. Over the cartilage, it is adherent. You can feel here, it is freely mobile over the bone. And the cartilage, it is little adherent. Okay, the skin of the nose is also important. Now coming to the internal nose. So when we go to the internal nose or nasal cavity, it is divided into right and left nasal cavity by septum. Septum is in the midline. It divides the nasal cavity into right nasal cavity and left nasal cavity. Okay. Now from anterior to posterior as we go, the nasal cavity communicate outside through the anterior nares. Anterior nares, it communicate outside. Similarly, posteriorly there is posterior nares or otherwise called choana, through which it communicate with the nasopharynx. Okay, the uppermost part of the pharynx. Now this cavity is divided into a skin lines area anteriorly, and behind there is a mucosal line portion which is called nasal cavity proper. So one vestibule, nasal vestibule, behind that is the mucosal line portion of the nasal cavity proper. I'll show you the picture, you can understand. Yeah. So in this picture you can see that is the cestal cut of the nasal cavity. Now this is totally nasal cavity. You can see it's a very big cavity. If you examine externally with thoricum nasal speculum, only you can see the lower part of the nasal cavity, but usually nasal cavity is very big. It is extended superiorly. So if you want to examine the nasal cavity properly, it is possible only by use of endoscope. Today, in the era of endoscope, you'll be able to examine the nasal cavity proper completely. Okay, now this line you can see, Anterior to this is the vestibule. The nasal cavity communicate outside through the anterior nares. Okay, now this is the vestibule, which is a skin line structure. Skin line structure. That is the reason any diseases in the skin can be manifested here, like furunculosis, dermatitis, any eczematous lesion. Everything can be possible in the nasal vestibule because it is covered by skin. Now, as you go posteriorly, this is covered by the mucosa. Mucosa. Normally the mucosa here is the respiratory mucosa, which is lined by pseudostratified columnar ciliated epithelium, respiratory epithelium. Okay. Now posteriorly, this nasal cavity, this is called choana. It is communicate. This is called nasopharynx. Communicate with the nasopharynx with posterior choana. Now into the nasopharynx, there is the opening of the eustachian tube. You can see here very clearly. This opening of the eustachian tube is in the nasopharynx. So this is the choana, this part exactly. Okay, is it clear now? So this is about the nasal cavity division, vestibule and nasal cavity proper. Next, coming to the vestibule, I told it's a skin line structure. So anterior and inferior part of the nasal cavity, it is usually found anterior and inferiorly. Just I'll show the picture again so that you can have an idea. See, this is the anterior. Why it is called inferior? You can see lot of nasal cavity is there superiorly. So it is usually inferior. So anterior and inferiorly, you'll get this vestibule because majority of the nasal cavity, part of the nasal cavity is there superiorly. Okay. Now anterior and inferior part of the nasal cavity, you'll get the vestibule. It is lined by skin. It contains the sebaceous gland, hair follicles, and the hair called vibrissae. Okay, so you can see the vibrissae will be there in the vestibule, and these are protective. This has got protective function. It purifies the air, trap the dust particles. That's why on that way it is very important. Now coming to the Lyman nasi, this is one of the important structure, Lyman nasi. Otherwise it is called nasal valve. Nasal valve. So it is formed. This is the formation of the nasal valve or Lyman nasi. It is formed by caudal margin of upper lateral cartilage. Okay, and the medial wall of the lower part of the nasal septum and columella. Okay, so columella, lower part of the nasal septum, and the caudal margin of the upper lateral cartilage. It is a circular like structure, circle like structure. So it is called the nasal valve or Lyman nasi. Okay, so this area is important for us because when the patient is complaining of nasal obstruction, there is a test called Cuttle test. You have to drag the chin like this, laterally and superiorly. If it improves, then it is Cuttle test positive. So when it improves, where the obstruction is in the nasal valve area. If obstruction is in nasal valve area, the Cuttle test will be positive. So then which structure usually causes nasal valve obstruction is the inferior anterior end of the inferior turbinate. So you have to do something for the inferior turbinate, anterior end. Then patient will have a nice free nasal cavity. So that is the reason nasal valve is important. If Cuttle test is negative, you are dragging like this, patient won't have any improvement. That means obstruction is not in the nasal valve area, it is somewhere else. Maybe at the medial part, maybe posteriorly. So you have to find out by doing some other test or some other investigations. Okay. Now coming to the nasal cavity proper, it consists of 4 walls like roof, floor, lateral wall, and medial wall. Okay, I'll show you roof, floor, lateral wall, medial wall. So coming to the roof, roof has got 3 portions. Anteriorly it is sloping, posteriorly sloping, and the medial part is horizontal like this. So it's like a roof, the normal roof. So anterior sloping part is mainly formed by nasal bone. Posterior sloping part is formed by the body of the sphenoid. I'll show that picture, you can understand. And the medial horizontal part is formed by the cruciform plate of the ethmoid bone, that is in the skull base. Okay, so let's see the picture. Yeah, so in this picture you can see this is the roof of the nasal cavity. This is here the nasal bone. Okay, nasal bone. This is the cruciform plate of the ethmoid. through which olfactory fiber goes inside. Cribbed from plate means there will be minute holes, small sieve-like structure it is, through which the olfactory fiber goes to the intracranial cavity. Okay, this area is the olfactory epithelium area. Now posteriorly, it is again sloping. It is formed by the body of the sphenoid, and this is the sphenoid sinus, you can see. So this body of the sphenoid contribute to the roof. Clear? Yeah. So now coming to the floor, anterior 3/4 of the floor is formed by the palatine process of maxilla. Palatine process of maxilla. Sometimes we called as palatine process of maxilla. Now posterior 1/3, 1/4 is formed by horizontal part of the palatine bone. Okay. Now I'll show that picture. Yeah. So this is the palatine process of maxilla. I think up to here. Yeah, up to here. Anterior 3/4, posterior 1/4 by perpendicular plate of palatine bone. Okay, horizontal part of the palatine bone. So this is the floor of the nasal cavity. Now coming to the lateral wall. This is the most important part of the nasal cavity because most of the surgeries are done here. Functionally, the recently functional endoscopic sinus surgery. The sinus surgeries are mainly done in this area because almost all the sinuses, they open here, and you have to identify those sinus. For that, you should have a thorough anatomical knowledge. Lateral wall of the nose. Okay, so grossly, it consists lateral wall contains 3 turbinates and 3 meatus. Turbinate means elevated structure, meatus means some depressed area below the turbinate or lateral to the turbinate. The depressed area is called meatus. So there are 3 turbinates and 3 meatus. Name superior, medial and inferior turbinate. Superior, medial and inferior turbinate. Sometimes, rarely, you will get extra turbinate which is called supreme turbinate. Above the superior turbinate, you will get the supreme turbinate, but not in all cases, some cases. Now, the largest turbinate is the inferior turbinate, found inferiorly. Almost it runs whole length of the nasal cavity proper. Whole length of the nasal cavity proper it runs. So the space lateral to this turbinate, it will be like this. So inside it covers some of the spaces. That space is called the meatus. Similarly, the space covered by the medial turbinate is called the medial meatus. The space covered by the superior turbinate laterally is called the superior meatus. That means once you suppose you cut and remove the inferior turbinate, this area you are able to see is called the inferior meatus, medial meatus and superior meatus. I'll show you that picture, then you'll have an idea. So lateral to each turbinate are the corresponding meatus. For the inferior meatus, medial turbinate, medial meatus, superior turbinate, superior meatus. Okay. Now coming to this picture, you can see here. This is the inferior turbinate, almost run the whole length of the nasal cavity proper. This is the anterior end, or like the inferior. This is the posterior end, whole length. Medial turbinate is a little smaller and superior to the inferior turbinate. Superior turbinate is still smaller. This is superior. Sometimes you'll get a small turbinate here. It will be the supreme turbinate. Very rarely you will get. Now, once you remove one of the turbinate, the area you will get there, this area is situated lateral to this turbinate. So those area is called the meatus. Like this is the medial turbinate. You remove this or you drag this medially. It will open a space lateral to this. That space is called the meatus. I'll show you one cutout picture of this medial turbinate. You can understand. Yeah. So inferior meatus run along the entire length of the lateral wall, mainly the nasal cavity proper. And one important structure open there in the inferior meatus is the nasolacrimal duct. Nasolacrimal duct open into the anterior part of the inferior meatus. Okay. Nasolacrimal duct usually comes from the lacrimal sac, come down and open into the inferior meatus. Okay. Now coming to the medial meatus, which is the most important area for us. So first and foremost important structure is the uncinate process. Uncinate process is called the trap door of the medial matters. Trap door of the medial matters, because unless you remove this, you cannot go inside the medial matters. So the first step in the functional endoscopic sinus surgery is to excise this uncinate process, which is called uncinectomy. Uncinectomy, excise the uncinate process. So uncinate process, the first structure you will see in the medial matters. After that, you will go posteriorly. You will see the bulla ethmoidalis. There is a ethmoidal cell, most constant ethmoidal cell. Okay, most constant ethmoidal cell, anterior ethmoidal cell, which is bigger, that is called bulla ethmoidalis. Now, what is hiatus semilunaris and ethmoidal infundibulum? These two are almost same structure, but little bit difference. So, what is the difference? So, what is hiatus semilunaris is, this is the area which is bounded anteriorly by the uncinate process, posteriorly by the bulla ethmoidalis. So, uncinate and bulla, in between the space is called the hiatus semilunaris. Ethmoidal infundibulum, also the same area. But what is the difference? Hiatus semilunaris is a two-dimensional space. Ethmoidal infundibulum is a three-dimensional space. How can I explain? See, you are drawing a picture, the picture of this uncinate process and bulla ethmoidalis. In this picture, you are showing a space in between, which is called hiatus semilunaris, because it's a two-dimensional picture. Now I'm doing endoscopy. In the endoscopy, I'm able to see a three-dimensional space, because it's not a two-dimensional space. Ideally, it is a three-dimensional space which is found in between bulla ethmoidalis and uncinate process. So that three-dimensional space is called ethmoidal infundibulum. Okay, so what we see in the book is a hiatus. What we see through endoscope is a bulla, ethmoidal infundibulum. Now coming to maxillary ostium, it usually opens to the ethmoidal infundibulum, and most of the time it opens. Uncinate process has got one vertical limb, one horizontal limb. At the junction, usually it opens the maxillary ostium. That is, in the maxillary ostium there will be natural ostium and accessory ostium. So usually natural ostium will open at the junction of the horizontal and vertical process in most of the cases. Some cases it may differ, and there will be sometimes accessory ostium. Accessory ostium you can see very easily with the endoscope, maybe 0-degree endoscope. So that is accessory ostium, usually which is rounded in shape. Some maxillary natural ostium usually oval in shape. So by inspection only you can identify and know whether it is a natural ostium or it is an accessory ostium. So that is called accessory maxillary opening. Okay. So ideally maxillary sinus open and drainage, whatever comes through the natural ostium. Maxillary ostium is a natural ostium. All the cilia, they beat towards the natural ostium. Yeah. So now you can see here, already you have seen this picture, inferior turbinate, medial turbinate, the superior turbinate. Now whatever structure I told, all will be inside this medial turbinate. So once you'll remove this medial turbinate, you'll be able to see all the structure. So let us remove this medial turbinate in this next picture. Yeah. So now you see here, this is the inferior turbinate which is removed. So once it is removed, you will see here a opening which is called opening of nasolacrimal duct. Okay. Now similarly, the medial turbinate has been removed, and what you will see here, these are the structure. This is the uncinate process. First structure, which is called trap door to the medial meatus. So if you want to go inside and see, you have to remove this one. Okay. Now this is the bulla ethmoidalis, rounded structure. The space in between this is called the hiatus semilunaris or ethmoidal infundibulum, three-dimensional space. Now this is bulla ethmoidalis, is the most constant anterior ethmoid ASL. Okay. Now sometimes there will be a few more smaller anterior ethmoidal air cells, but this is most constant and largest. Okay. Now this is the anterior ethmoidal air cells, and behind that you will get the basal lamella or ground lamella. So what is basal lamella or ground lamella? This is the attachment of the medial turbinate. Attachment of the medial turbinate to the lamina. Lamina is the medial wall of the orbit. So in between the orbit and nasal cavity, there is a very thin bone which is called lamina papyracum. So medial turbinate goes like this, turn and attach to the lamina, So while turning and attaching lamina, it produces a lamella which is called ground lamella or basal lamella. So you can see here the attachment of medial turbinate. Here it comes like this, it goes like this and come posteriorly. So this area, it turns and attaches to the lamina papyri. So that is called basal lamella. So behind that you will get the posterior ethmoidal cells. So these are the anterior ethmoidal cells, and behind the ground lamella and superiorly will be the posterior ethmoidal cells. So during the surgery, if you have finished removing the anterior ethmoidal cell in ethmoidectomy, then if you want to remove the posterior ethmoid cell or you want to approach the posterior ethmoid, you have to, here's this one. You have to remove this basal lamella, then you will have the access to posterior ethmoidal layer cells. The posterior ethmoidal layer cells will be bigger, anterior ethmoidal layer cells will be smaller. Posterior ethmoidal layer cells will be bigger and less in number. Anterior ethmoidal layer cells will be smaller and more in number. Okay. Now let's see about the superior meatus. So again, the superior meatus is found under the cover of the superior turbinate. Once you remove this, you'll be able to see the superior meatus. So superior meatus limited to the posterior third of the nasal wall. So you have seen superior meatus is the smallest, very small, found superiorly. Similarly, superior meatus also like that, it is situated in very small area. Okay. The posterior ethmoidal sinuses open into it. Posterior ethmoid sinuses are big cells, air cells, but it open into the superior meatus, which is a very small space. Okay. Now, once you cut the superior turbinate, you can see the superior meatus. Now, what is another important thing is spinoethmoidal recess. Spinoethmoidal recess. Why the name is spino and ethmoid? Because it is somewhere related to sphenoid sinus and somewhere related to ethmoid sinus. Yes. So the medial to the superior turbinate, there is an area where sphenoid sinus will drain. And to this area also the posterior ethmoid sinus drain. Posterior ethmoid sinus first drain to the superior meatus, then the secretion comes and come down to the this space which is called sphenoethmoidal recess. Just I'll show that area. Now you can see here. This is the cut end of the medial turbinate. This is the cut end of superior turbinate. So this will be the superior meatus area. So now you can see this is the sphenoid sinus. This is the opening of the sphenoid sinus. Now this sinus drain to this area. Suppose this is the superior meatus. This area is the medial to superior meatus. So this is called sphenoethmoidal recess up to here. So up to this recess, sphenoid sinus will drain, and the posterior ethmoid sinus first drain to the superior meatus. Then from there, the secretion come down into the sphenoethmoidal recess. Clear? Then the secretion goes into the nasopharynx slowly. So this area is called the superior meatus, sphenoethmoidal recess. Now coming to the medial wall. Medial wall is mainly formed by the nasal septum. Okay, so nasal septum forms the medial wall. It has got three parts: membranous septum, the cartilaginous septum, and bony septum. It will be told you extensively in case of septum disease. Nasal septum and its disease will go a little more deeper, but here you have to understand, if you go more anteriorly, you'll see very thin area that is called membranous septum. Behind that, cartilaginous septum. Behind that is the bony septum. Coming to that, what is this? So membranous septum is a very small area which consists of double layer of skin only. Intervening, there is no structure like bone or cartilage, only made up of skin, that to double layer skin. Now, as you go posteriorly, there is cartilage, that is called cartilaginous septum, which is made up of quadrilateral cartilage. Okay. Now, as you go behind the quadrilateral cartilage, then the type of septum is called bony septum. Okay, so this bony septum is mainly formed by two major bone. What is called? One is superiorly the perpendicular plate of the ethmoid, inferiorly is the vomer bone. So these two constitute the major part of the bony nasal septum. Apart from this, there are very small contribution from other bones. That's not very important for you. Just I'll show you that picture, then you can understand. So now you can see this is the cartilage, this is the bone, these are the bones. Now this anterior to this, there is a skin line structure which is called the membranous septum. No bone or cartilage, only 2 layers of skin. Okay. Now going posteriorly, this is the cartilaginous septum that is made up of quadrilateral cartilage and 2 layers of mucosa, 2 layers of mucosa, both sides. Now posteriorly, it is a bony septum and major contribution, this is the perpendicular plate of the ethmoid up to here. You can see the suture line, perpendicular plate of the ethmoid. Then below that is the vomer bone. This is the vomer bone. Okay, so this two gives the major contribution to the bony septum. Apart from this, there are some minor contributions. Superiorly, the frontal press of nasal press of frontal bone. Here this is the rostrum of the sphenoid, the maxillary crest, palatine crest. So all these have minor, small contribution. Okay, so this is all about the nasal septum. Now coming to the lining membrane of the internal nose. As I have already told, vestibule is lined by skin, normal skin. So any disease in the skin is possible in the vestibule. Now there is another specialized structure, epithelium, which is called olfactory epithelium, which is usually found in the olfactory region. Olfactory region is the roof of the nasal cavity. Just we have discussed in the roof of the nasal cavity. Superiorly, there is cribriform plate, small sieve-like structure, the sieve. So those sieves are usually through which the olfactory fiber runs from the nasal cavity, from the olfactory epithelium into the intercranial cavity. This fiber runs. Okay, so that is called olfactory region superiorly. Now below this, there is the respiratory region where you will get the respiratory epithelium, olfactory epithelium and respiratory epithelium. So what is respiratory epithelium? It is none other than pseudostratified columnar ciliated epithelium. It has got small cilia which will move and which will help in protecting the nasal cavity. Any dust particle, it will move. Okay, and it is helpful in moving the secretions also posteriorly. Usually the movement is posterior towards the posterior nasal cavity. So that is usually pseudostratified columnar ciliated epithelium. Now coming to the non-supply of nasal cavity, superiorly you are getting the olfactory epithelium. So usually the non-supply there is the olfactory nerve. It is a sensory nerve. Take the olfaction, sense of olfaction, smell. Okay. Now regarding the common senses, normal senses, the anterior ethmoidal nerve, sphenopalatine ganglion, infraorbital nerve. So these are the nerve usually take the general sense system from the nasal cavity. And there is a autonomic nervous system also, which is responsible for secretions. Some person will be emotional nasal secretion increases. This is mainly controlled by autonomic nerve fibers, and it is mainly supplied by the median nerve. Median nerve. Sometimes in case of allergic rhinitis also, or in case of vasomotor rhinitis particularly, allergic rhinitis intractable, it is not responding to any medication. There also you can go for median neurectomy. You can cut the median nerve. Particularly in vasomotor rhinitis, you can cut the median nerve, which is called median neurectomy. Okay, so that will reduce the secretions. Now coming to the blood supply, nasal cavity is highly vascular. It is mainly supplied by 5 arteries. Can you see here? Sphenopalatine artery is the major contribution. Most of the area supplied by sphenopalatine artery. Others are greater palatine artery, anterior ethmoidal artery, posterior ethmoidal artery, and superior labial artery. So this out of this 5 artery, the 4 artery, except this posterior ethmoidal artery, all of the 4 arteries they contribute form a plexus anterior-inferior part of the septum, which is called Kesselbeck plexus, and that area is called Little's area. That area is the area of epistaxis. Okay, the area of epistaxis that will be discussed in the epistaxis classes. So how this area is formed and what are the different things causing epistaxis, how to manage a case of epistaxis. So just you have to remember these 5 arteries which contribute supply to the nasal cavity. That means nasal cavity is highly vascular and it is supplied by the branches of both external and internal carotid artery. Okay. Now coming to the lymphatic drainage, why the lymphatic drainage is important? Because it is important in case of tumors, mainly the malignant tumors, because sometimes tumor in the nose or nasal cavity or sinuses, it will drain to the lymph nodes. That may be in the neck, that may be in the retropharyngeal space. So for that, you should know where is the drainage, lymphatic drainage of this area. So external nose and anterior part of the nasal cavity skin line is drained to the submandibular node, whereas the rest of the nasal cavity is drained to the upper jugular node, either directly or through the retropharyngeal node. That means first it goes to the retropharyngeal node, then come to the upper jugular node, or sometimes it can go directly to the upper jugular node. Okay. Upper jugular node is the upper 1/3 of the sternomastoid muscle. Sternomastoid muscle you can divide into 3 parts, and upper jugular, mid jugular, and lower jugular. So usually nasal cavity drain into the upper jugular. So this is all about the anatomy of the nasal cavity. If you have any query, you can ask. Okay, and in the next class we will discuss about the physiology of the nasal